Welcome to my channel, RX Sam 2020. Today we discuss a drug named Metoprolol. About Metoprolol is a selective beta-1 receptor blocker medication. By working on the beta-1 receptor of the cardiac muscle cells, it yields both a chronotropic, may change the heart rate and rhythm, and an inotropic, agent that alters the force or energy of muscular contractions, effect. It is used to treat high blood pressure, chest pain due to poor blood flow to the heart, and a number of conditions involving an abnormally fast heart rate. Metoprolol may be combined with hydrochlorothiazide, a diuretic, in a single tablet. Medical uses. Metoprolol is used for a number of conditions, including hypertension, angina, acute myocardial infarction, supraventricular tachycardia, ventricular tachycardia, congestive heart failure, and the prevention of migraine headaches. It is an adjunct in the treatment of hyperthyroidism. Off-label uses include supraventricular tachycardia and thyroid storm. The different salt versions of metoprolol, metoprolol tartrate and metoprolol succinate are approved for different conditions and are not interchangeable. What is beta blockers, also spelled beta blockers, are a class of medications that are predominantly used to manage abnormal heart rhythms and to protect the heart from a second heart attack after a first heart attack. Secondary prevention. Angina, also known as angina pectoris, is chest pain or pressure usually caused by insufficient blood flow to the heart muscle, myocardium. It is most commonly a symptom of coronary artery disease. A myocardial infarction, MI, commonly known as a heart attack, occurs when blood flow decreases or stops in the coronary artery of the heart, causing damage to the heart muscle. The most common symptom is chest pain or discomfort, which may travel into the shoulder, arm, back, neck or jaw. Heart failure, HF, also known as congestive heart failure, CHF, is a syndrome, a group of signs and symptoms caused by impairment of the heart's function to pump blood. Symptoms commonly include shortness of breath, excessive tiredness, and leg swelling. It may cause shortness of breath when exercising or while lying down, and may wake a person up at night. Notably, chest pain including angina is not typically caused by heart failure but can occur if the heart failure is caused by a heart attack. Supraventricular tachycardia, SVT, is an umbrella term for fast heart rhythms arising from the upper part of the heart. This is in contrast to the other group of fast heart rhythms, ventricular tachycardia, which start within the lower chambers of the heart. Ventricular tachycardia, VTach or VT, is a fast heart rate arising from the lower chambers of the heart. Although a few seconds of VT may not result in permanent problems, longer periods are dangerous, and multiple episodes over a short period of time are referred to as an electrical storm. Migraine. Migraine is a common neurological disorder characterized by recurrent headaches. Typically, the associated headache affects one side of the head, is pulsating in nature, may be moderate to severe in intensity, and could last from a few hours to 3 days. Bradycardia. Also, sinus bradycardia is a slow resting heart rate, commonly under 60 beats per minute, BPM, as determined by an electrocardiogram. It is considered to be a normal heart rate during sleep, in young and healthy or elderly adults, and in athletes. Thyroid storm is a rare but severe and potentially life-threatening complication of hyperthyroidism, overactivity of the thyroid gland. It is characterized by a high fever, temperatures often above 40 degrees Celsius or 104 degrees Fahrenheit, fast and often irregular heartbeat, elevated blood pressure, vomiting, diarrhea, and agitation. Dosage. Metoprolol is sold in formulations that can be taken by mouth or given intravenously. The medication is often taken twice a day. The extended-release formulation is taken once per day. Hypertension. Adult. Conventional preparation, initially, 50 to 100 mg daily in single or two divided doses, may increase weekly to 400 mg daily depending on response. Maintenance, 100 to 200 mg daily, up to 400 mg daily. Extended release preparation, 25 to 100 mg once daily. Angina pectoris. Adult, 50 to 100 mg twice or thrice in a day. Cardiac arrhythmias. Adult, 50 mg twice or thrice in a day, increased to 300 mg daily in divided doses if needed. Adjunct in hyperthyroidism. Adult, 50 mg 4 times daily. Prophylaxis of migraine. Adult, 100 to 200 mg daily in divided doses. Stable symptomatic heart failure. Adult, as a modified release preparation of metoprolol succinate, initially 12.5 to 25 mg of equivalent metoprolol tartrate dose, increase, as tolerated, at 2-week intervals to a maximum of 20 mg once daily. Intravenous. Emergency treatment of cardiac arrhythmias. Adult, initially, up to 5 mg at a rate of 1 to 2 mg per minute, may repeat at 5-minute intervals if needed up to a total dose of 10 to 15 mg. When acute arrhythmias are controlled, initiate maintenance therapy 4 to 6 hours after IV therapy using oral therapy not exceeding 50 mg 3 times a day. Prophylaxis or control of arrhythmias on induction of anesthesia. Adult, 2 to 4 mg, as slow injection may repeat injections of 2 mg as necessary up to a maximum total dose of 10 mg. Adjunct in the early management of acute myocardial infarction. Adult, administer within 12 hours of the onset of chest pain. 5 mg at 2-minute intervals to a total of 15 mg if tolerated. After 15 minutes, for patients who have received a full IV dose, initiate oral therapy of 50 mg every 6 hours for 2 days. For patients who did not tolerate the full IV dose, the reduced oral dose should be given as and when their condition permits. Subsequent maintenance, 100 mg twice a day via the oral route. Children, 1 to 5 mg/kg day into divided doses. What food should avoid while taking metoprolol? Because metoprolol is a beta blocker, a type of drug known to increase potassium levels in the blood, you might want to be mindful of potassium-rich foods like meat, bananas, and sweet potatoes. Contraindications. Second or third degree AV block. 6 sinus syndrome, decompensated heart failure. Clinically relevant sinus bradycardia. Severe peripheral arterial circulatory disorders. Cardiogenic shock. Asthma. Pheochromocytoma without alpha blockade. Systolic BP less than 100 mmHg. Metabolic acidosis. Pregnancy, second and third trimesters. Drug interactions. A product that may interact with this drug is fingolimod. Other medications can affect the removal of metoprolol from your body, which may affect how metoprolol works. Examples include lumefantrine, propafenone, quinidine, SSRI antidepressants such as fluoxetine and paroxetine. Special precautions. Compensated heart failure, bronchospastic disease, hepatic impairment, AV, atrioventricular, conduction disorders, bradycardia, peripheral arterial circulatory disorders. An alpha blocker should be given concurrently in patients with pheochromocytoma. May mask signs of acute hypoglycemia. May mask symptoms of hyperthyroidism. Caution when used in patients with a history of cardiac failure or those with minimal cardiac reserve. Avoid using anesthetic agents that may depress the myocardium. May impair the ability to drive or operate machinery. Myasthenia gravis, history of psychiatric disorder. Consuming alcohol while taking metoprolol may cause mild body rashes and is not advised. Avoid abrupt drug withdrawal. Pregnancy, this may affect the fetus. Pediatrics, reduced dose necessary. Lactation, may pass in breast milk, hence use only if clearly indicated. Elderly, reduced the dose, if necessary. Common side effects, especially with higher doses of metoprolol. Headache, nightmares, hypotension, eye reactions, skin reactions, dizziness. Serious side effects are advised to be reported immediately. Bradycardia, fainting and unusual fatigue, bluish discoloration of the fingers and toes and/or lips, numbness, tingling, swelling of the hands or feet, sexual dysfunction, erectile dysfunction, hair loss, breathing difficulty, mental mood changes, cough, depression, increased thirst, dyslipidemia. Mechanism of action. Metoprolol blocks beta-1 adrenergic receptors in heart muscle cells, thereby decreasing the slope of phase 4 in the nodal action potential, reducing sodium uptake, and prolonging the repolarization of phase 3, slowing down potassium release. It also suppresses the norepinephrine-induced increase in the sarcoplasmic reticulum calcium to ion leak and the spontaneous sarcoplasmic reticulum calcium to ion release, which are the major triggers for atrial fibrillation. Some brand names which are prescribed by doctors: Beta-Loc, Lopressor, Metoller, Prolomet. If you want information on a particular medicine, mention it in the comment section. Thank you for watching. Please subscribe, like, and share the video.